So I am Leonila Ocampo. So formerly a president of the Philippine Pharmacist Association. So I held the position for 4 years. Currently, I'm part of the Exicom of the Community Pharmacy section of FIP. Also, I'm operating a consultancy company called the Asia Pacific Institute for Medication Management. So it is this company that works with the government and other private organizations or corporations for the training of their staff, for the training of people on how proper use of medicine should happen from procurement down to disposal. So we run trainings through this company. And I'm very happy and very thankful that I'm given the opportunity to be with you, with this group, to share the little things that we're doing. Everybody knows how significant the role of the community pharmacist is to the health of the people or of the community. We are the most accessible health professional to the community. We are located in the heart of communities.
Yep.
And in my case here, in my country, we could be accessed actually for free because pharmacy services here is not yet paid for or not remunerated. What is paid for by clients of pharmacy in the country are the medicines that we will be dispensing to them. My work is improving how pharmacy services has to be delivered to the community such that it's not just the plain giving of medicines that we do to our clients, but the services that should go, the so-called pharmaceutical care services that should go with the dispensing of that medicine, so that our medicines given to clients could be used responsibly and rationally. You know, there's a lot of misuse, irrational use, and abuse in the use of medicines here with us, given that anybody can just access medicines even for prescription medicines without a prescription. But with the change of the pharmacy law, we were able to little by little change the way how things are happening in our pharmacy counter. The very access of buying, in fact, antimicrobials without prescription is not happening today anymore. The support that we get also from our government leaders, very good. They have come to understand how important our role is to ensure safety, medication safety, specifically of anybody who would need to use medicines, and how important our role is to allow optimization of benefits from the use of medications or of medicines. We are right now working in developing some specialization in pharmacy practice because we have seen the need of this. And we were also able to successfully lobby for the requirement of really having a certification process for anyone who would be working with a pharmacist, that right now we have the government certification program for our pharmacy assistants already, because these are the people who are directly engaged in interacting with patients, but they do not undergo in the past a structured training and does not even or do not even understand very clearly and very well what the nature of medicines are as products that they are giving to clients who would need it. We have to understand that medicines are double-edged products. While they heal, they can also kill. So we have to be very careful in giving it out. We have to expand and extend to work with our fellow health workers, like working collaboratively with medical doctors, and then side by side also work with patient groups. So we would be able to give awareness campaign to our patients, how they could responsibly be using the medicines that would be given to them. We cannot be working on our own without the support of our fellow health practitioners. We have little by little changed the mindset of our fellow health workers here, how they look at pharmacists as a health professional. We set up health facilities in the rural areas. Residents of the community would be able to access the medicines that they need. And this Butika ng Bayan, we call it Butika ng Bayan, so translated as village pharmacies, we were able to bring in patients who do not have access to medicines, build up the database for these people so the government would have a guide how many have to be given these kind of medicines in that particular area.
Okay.
So we are looking forward to really be able to build a good database, especially of chronic patients, for better guidance of our government procurement people as to what should be bought and brought down to the different facilities in the ground. These are outlets or pharmacies that gives medicines for free to the less privileged Filipinos or residents of the country.
Okay.
These are located in rural areas most especially. We do have also some in the urban areas, especially those that are quite far already from pharmacies and from hospitals. We reach out to the community. We just don't stay in the pharmacy and wait for the people to come.
Okay.
Because it's very inconvenient for our clients, especially the underprivileged who do not even have any amount to pay for the fare or the transportation in coming to where the facilities are located. We developed kits so that we would be able to give this to those, especially to the more vulnerable groups, to 250 families from 3 different villages. Give them a kit that contains medicines for minor ailments.
Okay. Okay.
Which are all labeled per medicine on how it should be used, when should it be used, what are the precautions, and when would they see the doctor when, let's say, there is fever, and after so number of doses, if the improvement is not as significant as we expect it be, then you have to see the doctor already. And we have to educate them that in a healthcare system, the very foundation of healthcare is self-care. And if we are able to strengthen that, then we'll listen coming into primary care to secondary and tertiary care. The pandemic has facilitated the implementation of the pharmacists being utilized to do vaccination. We facilitated, in fact, the training of our pharmacists to really get into doing the job, and the accreditation of pharmacies as centers where people could approach to for their immunization. The recognition of the pharmacists by the community, both government and non-government, became more prominent. We really have to bring them in. We really have to have them be on board, while we in the older groups are working, because these are the very people who will be doing what we're doing now as we start to exit, as we start to retire. And the advice that I could give to our young pharmacists is for them to really be willing to learn. They should have that passion to do better. They might have been doing already good now, but they should always endeavor to make things be done better and not stop. Because and they should have the kind of mindset that giving up should not be an option for me as a pharmacist, because I'm needed by the community. So there might be some difficulties encountered in the process of doing the work, in delivering our job, but these are just part of what we would experience in life to make us better. For as long as they have the patience, they have the passion to do the work, they love to interact, to serve people, then no reason for them not to be able to do what are expected of them to do. what actually caught my attention and the things that you said would want to talk to with me is how we could improve resilience. So that is very important, especially for a pharmacist working in the community, because it's not always that we succeed. There are things that sometimes would put us not to get what we want, but we should be able to recover quickly, immediately, no matter how tough the experience we encountered to is. So learn to be very resilient as a health professional.
Yeah,
So
capacity
thank
to
you so
learn
much.
and to improve practice. Yeah,
Yeah.
definitely. Absolutely.
So thank you
Well,
so much.